This is medical terminology, chapter 7, the urinary system. What are the learning objectives? What we want to learn from chapter 7 with the PowerPoint slide? We want to go ahead and learn the function of the urinary system, and we want to learn the different parts and how these parts work together to go ahead and make up the urinary system. We want to go ahead and learn about the different word parts that are associated with the urinary system. This would be the prefixes, combining form, and suffix. And then we want to go ahead and look at some of the pathologic conditions with the urinary system. The function of the urinary system, a big role of your urinary system is to go ahead maintain homeostasis. This is mentioned in your textbook. Homeostasis, actually, if you simplify, is trying to maintain the internal operation of balance and balance within your body. And how this is done is through the filtering of blood and excreting waste products that your body doesn't need, and this is done through your kidneys. It maintains the consistent balance in water, salts, and other substance that your body may need or may not need. It maintains blood pH, and it also maintains blood volume and blood pressure. We're going to talk about the structure of your urinary system. Your urinary system is made up of your kidneys, your ureters, and your urinary bladder, and then your urethra, where your urine exits out. Your kidneys are located in your posterior dorsal area, kind of in your lower back area. If you should ever get a blunt, impact or injury to your back, you can go ahead and injure your kidneys. So because of the location it is in, it's more in your posterior back area. You will see that in this picture, it tries to outline your circulatory system, your vena cava, and also your aorta. And in your circulatory system, remember the aorta brings in the oxygen-rich blood, and then the vein brings back the deoxygenated, poor blood, oxygenated blood back to your heart to go ahead and be pumped out to get oxygen. So it's just kind of showing you the arteries, the artery and the big artery and the big vein here, and then it divides out into the arteries and veins into your kidney, which will filter your blood, and we will go into that with other slides. Your kidney, your right kidney is located a little bit lower than your left kidney. And the reason for that is the liver is not, shown on this diagram, but your liver is kind of situated superior to your kidney here. So it's kind of pushing on your kidney. So that's why your right kidney is lower than your left kidney. It has the adrenal gland here that produces hormones. We will talk about the adrenal gland later in the endocrine system, which talks about several hormone-related glands that release some of these specific hormones to your body. And so you will see these ureters, two of them going down. When the urine travels down, there is that peristalsis. Your ureters have muscles, and through peristalsis, which is the contraction, the urine will travel down along with gravity, of course, and your urine will go ahead and sit in your bladder and before it is released through your urethra. There are sphincters, muscles in the bladder going out of your bladder by your urethra that the muscles allow you to control the excretion of urine. And so that's how you're able to go ahead and hold on to your bladder sometimes. And when you need to go to the bathroom and urinate, you can hold on to your bladder. And then what happens is that as we age, those muscles do become more laxant. So women do have more problems with bladder incontinence. Since your kidneys are really the main organ that does the filtering, we're going to go ahead and talk about your kidneys and the filtration process with the next few slides. You will see that your kidney has two layers. The outer layer is your cortex, and it's kind of right around this area. And then you have the inner layer called your medulla. In your medulla area, you have these renal pyramid, and really these renal pyramid are where your nephrons are, and your nephrons are your filtering units. And so we will be discussing your nephrons with the next slide. But your kidney also does have this capsule around it to protect it. When you look at this, you see that there is the renal artery that goes in, and then you also see that there's a renal vein that goes in as well. And there is your hilum. Hilum is kind of the section here. So when the urine does, come back out, it'll come into the hilum area, kind of the tunnel, that's the brown tunnels in here, and it will sit in this kind of the renal pelvis area. Then it will kind of go down the urethra to be eliminated from your body. We're going to further look at your kidney and look at the nephrons. The nephrons are actually the filtering system that filters the blood and removes the waste products and reabsorbs the water or nutrients that you need. And so when you look at this diagram, you will see that they try to go ahead and take a section of the nephron and show you how the nephron looks and diagram it out. So there is a million nephrons in your kidney, and so these nephrons contain the glomerulus and the tubulars. The nephron has three important functions: glomerular filtration, tubular reabsorption, and tubular secretion. So let's go into this. So you will see that here are your arteries and your veins. So your artery is gonna branch out into, and it's gonna end up going into small arterioles, and then it'll end up being capillaries. So you'll see here, I wanted to go ahead and this calyx here, it wasn't mentioned earlier, but you can kind of see that they're kind of located in here. These calyx is where kind of the urine will be coming out of this, and then it'll go into your renal pelvic area and then and down to your urethra. So I just want to make sure that I talk about this, which I didn't talk with the earlier slide. So let's look at this section of the nephron. So you will see that the artery comes in and it goes into this section called the glomerulus, and it's mentioned here, glomerular filtration. So what happens is with the pressure of the blood volume coming in here, this pressure force goes on ahead and helps out with the filtering process. So what will happen is the fluid, the nutrients, and the glucose, the ions, whatever it is, it gets kind of pushed out into these tubes. And this little section area is called your renal corpus, and it's also called your Bowman capsule. This is where the absorption starts to take place. So it will go into this tube called your proximal convoluted tubule. PCT, and this is where a lot of the absorption takes place because you still need some of that nutrients, you still need some of that electrolytes, the ions, and the fluid, of course. And so a lot of absorption takes place in here so that you don't lose all your important nutrients, your glucose, your ion, your electrolytes. What happens then, it will go down to this loop of Henle. This loop of Henle tries to go ahead and absorb more of the water so that your body can use it, and some of the, sodium as well, the electrolytes that your body might need, and then it travels back up, and then this distal convoluted tube, DC DCT tube is very important. It tries to go ahead and absorb some of the sodium and water as well. And a big part of this distal convoluted tubule is it does secrete some of the drugs or some of the toxins in your blood that needs to be eliminated by your body. So this distal convoluted tubule is very important because it is the tubular secretion. So any remaining products that your body doesn't need is then eliminated here. And a lot of time that has to do with the drugs that you take or any toxin that's in your body. It is secreted back out, and then it goes down this collecting tube. Then it is then further eliminated into the renal pelvis. Remember I talked about the renal pelvis? So in this, it goes out to the renal pelvis, and then it comes down to the urethra, goes down to your urinary bladder, and then it's secreted out through your urethra. And then this diagram that I have here also is looking at the microscopic level, where it shows you the renal artery and arterioles. And so I go into these smaller capillary arterial capillaries, and what happens here, again, this is a better picture. Here's your Bowman capsule that's up out here. So the force from the blood volume in your capillaries here will go ahead and force out the water, the sodium, the electrolytes, the nutrients, the glucose. And so some of this water and some of these glucose and nutrients, you want to keep it. So here is the proximal tubular that is kind of in this section. It reabsorbs it back in. Then it comes out to this loop of Henle where most of it's trying to go ahead and absorb some of that sodium and chloride and water that your body needs, because you don't want all that water to losing all that water. So then it helps to reabsorb that. And then you have the distal tubulars here, and this is where it's very important because this is where the toxins are excreted out. Whatever waste is not needed in your body here is then further excreted out, and it becomes urine, and then it comes into this collecting tubular. And so I have a YouTube video here that you can watch, and you can go into this further. There are other functions that is mentioned in your textbook in regards to the kidney. The kidney does produce and release renin, which raises blood pressure. Renin is an enzyme that helps to go ahead and control that blood pressure. And then it also produces and excretes the hormone erythropoietin, which stimulates the production of red blood cell. And then it also releases other hormones, calciferol is one of them, in which they can go ahead and help with the absorption of calcium in the intestine. Word parts, I just put on here, please go ahead and review page 206 and page 310. We will, go ahead and do a Kahoot in class session. We talk about laboratory tests. In the textbook, it talks about some of the laboratory tests, and so it talks about urine specimen types, the ones that you go ahead and just, it's not a clean catch, you just kind of void into a container. A clean catch is more of, where you really need to wipe yourself down in order to get a clean urine sample. And then, of course, the sterile, which is they catheterize you to get urine in your bladder for testing. And so some of this, testing is done to go ahead and find out what kind of bacteria is in your urine. Sometimes we have urinary tract infection and they need to find out what bacteria is causing you to have your, they call it UTIs. And so they will go ahead and do a urine culture, and they will do a sensitivity, which they test out the antibiotics to see which antibiotics kills off this antibiotic. And then they will go ahead and prescribe that to antibiotics to make sure that it is the correct antibiotic for the bladder infection that you have. Creatinine clearance test, renal clearance test is a test just to kind of see. Creatinine is more of, your muscle breakdown than anything. They're testing to see what's happening within your body. If you're getting high level creatinine, that's related to muscle tissue. And renal clearance test, looking to see how your kidney is filtering your blood, and if it is doing a good job at filtering. Sometimes as we age, the ability for our kidneys to filter actually slows down, or if we get infection or if something happens that we are not able to clear our urine as quickly. And then they do go ahead and put some blood study, serum creatinine, kind of to see, renal impairment, how your kidneys are doing, as well as muscle mass loss, and then BUN, blood urea nitrogen. It kind of looks at your liver, and it also looks at your kidney to kind of see what's going on if there is liver and kidney failure. We talk about indwelling catheter. Many of you are aware of these indwelling catheters. Sometimes we put in these indwelling catheter to either get a urine sample, or maybe you have a Foley catheter inserted in where you're going to have a surgery, or people who are having issues might have an indwelling catheter, and in which their urine will go into a bag. It's kind of a collection of their urine. And then this is a picture of urinary catheterization. It's kind of entering a catheter, which is a tube like, into the bladder so that it can go ahead and catch the urine sample, or go ahead and help the urine to be excreted. Cytoscope is sometimes done when there's issue with the bladder and they really need to go in and look at what's going on in your bladder. So the cytoscope is put into your urethra to give the physician a better look at your bladder. Urinary tract pathologies. Here, sometimes it's really hard because we think it's a bladder infection, and sometimes it's not a bladder infection. They can't find out what's going on. They put it in the category of irritable bladder syndrome, the constant urge to urinate. And so as we age, sometimes, I had a situation where, my one of my relatives kind of went in and went for UTI testing, testing, no bladder infection, couldn't figure out, kidneys are fine and so forth. And finally, a scope was done to look at the inside of the bladder. And so the doctor diagnosed it as more on the inside of our bladder. We have a coating in the inner layer, and sometimes that coating just, mucus coating just um, starts to not be there. And so every time we have urine in our bladder, it just irritates it. So sometimes if they can't find a reason why, they put it in the irritable bladder syndrome. Polyuria, poly means, many, lot. So polyuria is more of the peeing out or urinating more, excessive urination. Anuria is more of not being able to urinate. And the classic urinary tract infection, UTIs, tends to be more common in females than in males. Sometimes you don't have signs and symptoms of a bladder infection. And if you do, a lot of time it's that urgency to urinate. You might have a backache, fever, and there might be blood and pus in your urine with the UTIs. And when you do have UTIs, you do go in and they'll test your urine and culture it and make sure that they prescribe you the correct antibiotic to kill the bacteria. And then your textbook does go into a lot of different procedures, which you can go ahead and study up on and look at. They are interesting, but I don't think they're really put onto your test. It's more of information for you to know about some of the pathologies and also some of the procedures that are done because of abnormality to the urinary system. And so here it talks about benign prostatic hyperplasia, BPH, which is a common one. And a lot of time it's common, 50 plus. It's enlargement of the prostate. It's not cancerous. It's not inflamed at all with that. And because of this, the enlargement of the prostate, it does sometimes interfere with urination, and it does lead to not being able to effectively urinate completely, or you'll have urine in at night, or you'll tend to have more urinary tract infections. So you'll kind of see here where the prostate is enlarged and it does cut off the urethra, and so people have issues with this condition. And that's it for my presentation on the urinary system.